It's long been held there are 4 pillars to dealing with drug addiction: prevention, law enforcement, harm reduction, and treatment. The HIV/AIDS prevention program, formerly the needle exchange, is part of that third pillar of harm reduction. Contrary to what many think, it has not been a needle exchange for years.
Through lots of research and evidence across Canada and through the province, that was sort of not considered best practice anymore, and so now we offer distribution and recovery. So we allow for people to bring in their used supplies for proper disposal, but we also distribute supplies or in quantities that are enough for people. So we're not restricting access to needles, because when we restrict access, we know that people share, they reuse, they steal used needles out of locked boxes. They put themselves actually at higher risk for HIV and Hep C in community. And so we don't want to restrict because there's greater harm in restriction.
But that model is a constant source of anxiety for community members who say they're having to pick up needles around their businesses and in community parks. Constable Trevor Hurley recounts one morning a couple of years ago that was particularly memorable. He and his partner came across a young woman one morning downtown who looked to be fine. It was a different story that afternoon. Clearly high, she was picked up. At the detachment, her bag was searched.
She had 107 syringes, 95 packets of the saline water in those blue containers. I don't know, 50 or 60 of those aluminum spoons that you heat up your drugs in, and as well as some of those rubber ties that you wrap around your arm to enlarge your veins, that kind of thing. And how does that happen?
The BC government declared an opioid crisis in 2016. In the past 10 years, the number of deaths related to illicit drug toxicity has grown from 4 deaths in Prince George to 49 at its height last year. 46 of those deaths are directly associated to fentanyl. That has dropped by more than half so far this year, with 13 of the 20 deaths tied to fentanyl. For the BC Ambulance Service, much has changed in terms of response.
From an EMS perspective, it's changed the frequency in which we're dealing with people living with addiction and experiencing an overdose. Back when I started 30-some years ago, we would have an overdose call once every couple of weeks, and now it's almost daily for our crews.
And while the province has declared it a crisis, that terminology no longer works for the BC Ambulance Service. Now it's a
severe and persistent threat to the health and wellness of our community.
The BC Coroner's Service says harm reduction efforts in some of the most blatant demographics is working, but the face of drug addiction is shocking.
What we know in our data is that about 70 to 80% of the deaths, depending on the community you're looking at, are occurring indoors. These are people that are using substances, often in private residences, often people using alone. So if they come across a bad batch of drugs, they don't have anyone there to help them.
Yeah, they end up dying alone, and it's really tragic because so much of that is to do with shame and blame, and so much of that comes from the broader community. People that use drugs already place a lot of blame and shame on themselves, and so to also experience from the community, it just compounds that. There isn't a single person that I can think of in my practice that actually stopped using drugs because they were treated poorly.
Deb Tremblay was an ambulance paramedic in Calgary for 3 decades. She cites one example of how easy it is to become hooked on some very powerful drugs. In this case, a family man was given painkillers after dental work and became addicted. When his prescription wasn't renewed, he turned to the illicit drug scene.
This is a family man, this is a man with a career, but he's now feeding an addiction. And in trying to maintain that addiction as well as his family and his career, he was taking little weekends away where he could feed his addiction away from his family, away from his career, and he was sourcing some illicit drugs, renting himself a hotel room for the weekend, and that was how he was feeding his addiction. And then Sunday night he would go home and continue with his family and his career life.
I think this is one of the reasons why we have...
Back to the 4 pillars of drug addiction.
But we still do our enforcement efforts best we can with the resources we have. And obviously there's been a lot of provincial money that's been poured into what's called harm reduction. I've been here 3 years. I haven't seen a whole lot with regards to the prevention and certainly on the treatment sides of things.
Have you seen any movement? Have you seen any positive improvement and harm reduction?
I've definitely seen an increase in harm reduction initiatives throughout the downtown core and elsewhere by a lot of the nonprofit groups.
Superintendent Sean Wright says where there is a definite lack is with the fourth pillar, the treatment for those who want out of the revolving door of drug addiction. Cheryl Jan, CKPG News.